Good morning, everyone. We're going to get started in about 5 minutes. All right, good morning, everyone. We're going to go ahead and get started today. I'd like to welcome everyone to the CMS COOP Program Emergency Relocation Group and Devolution Emergency Response Group member annual training. The training today will cover COOP 101 as required by HHS on a yearly basis, and we will discuss the purpose a little bit more in a minute. My name is Commander Jabel Chase, and my EPRO counterparts here with us this morning are Dan Converse, Patricia Willis. Out in the front, we have Scott Crumbaugh and Maxine Hudson. Now, as far as attendance, for those of you that are here in the auditorium today, please make sure that you sign in at the front desk so that your attendance can be counted. For those of you who are viewing on YouTube today, I ask that you send an email to the EPRO mailbox, which is epro@cms.hhs.gov. Again, that's epro@cms.hhs.gov. Also, for those of you at home, in the email appointment, I attached a copy of the evaluation form. Please send that at the end of the training to the EPRO mailbox as well. And for those of you here, please make sure to fill out the evaluation and hand it to one of my EPRO counterparts as you leave today. Of note today, at 10:18 a.m., CMS will be conducting an earthquake drill in all Baltimore-based buildings. This event is known as the Great Shakeout, which will help you to learn what to do in the event of an earthquake. The drill will last approximately 60 seconds. For those of us here in the room, we're just going to remain here in the room. Once the announcement is over and we have it all clear, we will continue with the presentation. For those of you who are viewing on YouTube, the screen will go to show a EPRO banner, and once it is over, we will go back to live streaming and we will continue with the presentation. So just be aware of that. And finally, I just ask everyone that during the presentation, please hold all of your questions until the end of the presentation, and I'll make sure to cover all of those. As you can see on the agenda today, we just had the introduction. We're going to have an overview of the CMS program, the COOP program and plan. We're going to talk about the Emergency Relocation Group, which you will hear me refer to as the ERG, preparedness activities. We'll talk about the Devolution Emergency Response Group, DERG, preparedness activities. We'd have the questions and answers. We'll have a few moments at the end for everyone to fill out the evaluation and to have a wrap up. And this year, what you'll notice is typically what we've done in the past is we've had a separate training for the ERG and a separate training for the DERG. But this year, we're combining both of those together because we want to make sure that the ERG and DERG are well aware of each other and are working together, because what this is about is extremely important for us as an agency in the case of an emergent event. Now, the purpose of our training today is we will discuss all of the different elements of the CMS continuity program. We will talk about different federal continuity guidance and directives, and then we'll go into detail to talk about the different essential functions. And they are the national essential functions. You have the HHS primary mission essential functions. You have the CMS mission essential function. And of course, you have what's known as essential supporting activities. We'll also talk about the elements of the CMS COOP plan, and we'll discuss those one by one. We'll talk about information on continuity strategies, and then we'll talk about the concept of operations, as well as discussing the ERG and DERG member checklist. And those are the different responsibilities that each of those group members are responsible for handling. Now, COOP is a federal initiative that ensures the continuation of essential functions across a wide range of emergencies. Now, as an agency, we have developed a COOP plan that allows us to respond to a full spectrum of vulnerabilities that may challenge our ability to operate normally during duty and non-duty hours. Now, our plan is what we call a one agency plan, and it provides guidance for CMS headquarters and all 10 of the regional offices. Now, the COOP plan can be activated in whole or in part, depending upon the situation. It depends on the size and the scope of it as well. Now, one of the things that it also does, it identifies the 5 MEFs, which I said earlier are the mission essential functions that must be continued or resumed rapidly after a disruption of normal events. That's something that's very important. That's our main focus, is for our agency during an event, is to continue performing our mission essential functions. Now, what are the plan objectives? We have to provide for the continuation of the MEFs and the ESAs during and after a disruptive event. We have to provide and maintain agency focus on the identification of resources needed for response and recovery. And that's very important as well, because when an emergency occurs, that's not when you need to decide what you need. There should be pre-planning should be done ahead of time so that we know what resources we need. Whether it be funding, staffing, whatever it may be, IT equipment, we need to already have those things in place if there's an emergency. We need to be able to protect and prioritize our facilities, equipment, records, and critical IT infrastructure. At the same time, it goes back to communication. We need to be able, that in an emergency, be able to provide communication to our employees, stakeholders, and the public as a whole, because everyone will want to know what's going on, and will CMS be able to continue carrying out its mission essential functions as necessary. We need to be able to assess and minimize the damages and losses. So we need to see what was affected. How much will it cost us? How quickly will we be able to get it restored? Or if we can't get it restored, will we have to go to a different location? What do we need to do? And of course, we need to be able to provide for organizational stability. So if one person isn't available, who will be able to step into their place to keep it going? Because the agency will still have to continue moving forward. And we need to be able to achieve a quick and orderly recovery. So that's the point that we'll talk about later, that's known as reconstitution. How can we get the agency from dealing with the emergency to getting back to being in a state of readiness? Now, this is a conversation that I've had with a number of people, because a lot of people get these two terms confused. And that's OEP compared to COOP. A lot of people think that they're the exact same thing, but they're not. OEP and COOP are definitely not the same thing. OEP, which stands for Occupant Emergency Plans, they support safety, evaluation, or sheltering in place as appropriate. They are applicable immediately following an event, and they are building specific. For example, if there were a fire in the building, staff would be going to a designated muster site as stated in the OEP. So that defines what an OEP is. COOP. COOP is the continuation of the agency's MEFs and ESAs after major events that disrupt normal operations. The COOP plan could be activated for days, weeks, or even months until the agency is prepared to restore normal operations. So as you can see, OEP and COOP are two completely separate things. Now, earlier I said that we talk about the directives. Now, the COOP plan receives its guidance and governance based off of presidential policy directives, national security presidential directives, as well as Homeland Security presidential directives. Back in July of 2016, President Obama issued what's known as Presidential Policy Directive 40, which requires that a comprehensive national continuity capability be established and maintained. And also, a lot of you have heard of, you'll hear a lot of people in the COOP world use the term FCD1, which stands for Federal Continuity Directive 1. And that is the basis, the overall guidance. That's what we as an agency, we look to in order to pull our directives as far as what we need to do and what needs to be included in our CMS COOP plan. So whenever we have anything, if you look into the COOP plan, we take all of our direction from FCD1, and then we expound on it from there to go more specifically on what we will do as an agency and who will be responsible for doing that. Now, this slide just shows a picture of what's called the continuity program management cycle. And if you look at it clockwise, it talks about the different stages of what we have to do. So it starts off at the top with plans and procedures. You go down to test training and exercises, and that's what we're doing today, training. You go to your next level, which are your evaluations, after action reports, and lessons learned. And then you go back around and you develop improvement plans. So each time we do something, you start off at the top with your plans and procedures. You look at it, you do different trainings, you do different exercises, you put it into play, and then you take a look to see what are your weaknesses. What can we do better? What do we need to change? Because as you all know, even in our day-to-day work here at the agency, sometimes when you write out a standard operating procedure or a business continuity plan, When you put it together in its own paper, it looks great. But once you put it into action, you realize that there are some things that are missing. So it gives you a chance to go back after you look at it to make some changes and say, hey, okay, we need to change this step, we need to change this step, this is what flows better, and this is what we need to do. So that's what's the same thing that happens when we're performing COOP. Now, when you look within that box, it's talking about how we perform all of our essential functions and who all is a part of that process. And if you look at the columns, you see leadership, staff, and facilities. And the last column is communication. And that really what ties everything together is communication. So as an agency, we need to be able to communicate with everyone openly and clearly on exactly what we are doing as an agency. Because you all know if some sort of emergency came up, staff will definitely be the first one. What's going on with the agency? Am I supposed to report to work? You know, is the agency shut down? What are we supposed to do? So we need to make sure that we have clear and open communications. Same thing with the public. They're going to want to know what's going on also. So we always need to make sure that we have clear and open communication coming from one source. Cannot have multiple sources giving out different answers on the same thing. So one source with the same information. As I stated, we were going to talk about all of the different elements of a CMS continuity program. And this slide lists all of those different elements. And we're going to talk about each of these individually. We're going to talk about the essential functions, orders of succession, delegations of authority, continuity facilities and capabilities, which also includes alternate work locations, continuity communications, essential records. We'll take a pause now. Okay, we'll go ahead and get started. Just waiting on the YouTube to come back up. Okay, so we were discussing the elements of a CMS continuity program. So I stopped off talking about essential records, and we'll really talk about that. Human resources. Then we have devolution, reconstitution, and then, of course, test training and exercises. All of the items that I just mentioned, they all stem from FCD1, and they are all requirements of a continuity program. If you're not familiar with FCD1 and you want to learn more about COOP and how CMS comes up with its COOP plan, you can take a look on FEMA's website and do a search for FCD1, Federal Continuity Directive Number 1, and it'll explain in detail all of the different items that we're about to talk about. And it talks about each of those of what's required of an agency to do. First thing we're going to talk about is essential functions. And as I mentioned earlier, we're going to talk about the national essential functions. And if you look at it, it starts at the top and it works its way down. The top is from the most important, working its way down. So your NEFs are the overarching responsibilities of the federal government of what needs to be done before, following, and during an emergency. And the primary focus of this is presidential and national leadership. When we go down to the next level, you'll hear people say PMFs, which are primary mission essential functions. Now, that's a subset of mission essential functions that must be continuously performed to support or implement the uninterrupted performance of the NEFs. So if you look at it, it's like building blocks. Then you get down to your next level, which are your MEFs, your mission essential functions. These are all agency specific, and they are directly related to what every agency must do in order to accomplish its mission as set forth in statutory or executive charter. Then you get down to your lowest level, which you'll hear people say ESAs, or your essential supporting activities. Now, these are critical functions that support the performance of the MEFs, but they do not reach the threshold of being a PMEF or a MEF. Now, as an agency, we have 5 MEFs, which I will cover all of those shortly. So let's talk about the MEFs. There are 8 functions that the president and the national leadership focus on to lead and sustain the nation during a catastrophic emergency. HHS directly supports NEFs 2, 6, and 8. Now, HHS just recently added NEF number 2 as an item that we support. So you can see those listed here on the slide, 2, 6, and 8. Next thing we're going to talk about are PMFs. Now, PMFs are functions that must be performed in order to support or implement the performance of NEFs before, during, and in the aftermath of an emergency. HHS has identified 3 of those to support the MEFs. Now, these were reviewed and approved by the White House in 2016. And you can see they're listed here of what we as an agency under HHS will be responsible for. And you can see prepare for, mitigate, respond to, and recover from public health and medical emergencies. We're dealing with safety procedures and products intended for human and animal use or consumption, and ensure continuous national leadership. So those are the PMFs that we're responsible for. Now let's talk about us as an agency dealing with MEFs, mission essential functions. As I stated earlier, CMS is responsible for 5 MEFs, and they support NEFs 2, 6, and 8. So the first MEF that we have as an agency deals with cash flow, and that's cash flow to external stakeholders to prevent lapses in healthcare coverage. Then we have MEF 2, which deals with enrollment. And that's enrollment of individuals in Medicare, Medicaid, the Children's Health Insurance Program, and in private healthcare plans through the health insurance marketplace. Then we have MEF 3, and you've heard me say this word a lot, communication. And that's the communication of health, policy, and emergency information to internal as well as external stakeholders. Number 4, end-stage renal disease, ESRD, and that's dealing with patient and facility tracking. Then 5, quality care for CMS program beneficiaries. Now, these MEFs were established by CMS back in 2009. So now it's about time for us as an agency for us to take another look at them, to review to see if these are still the same MEFs that we need. Do we need to add more? Do we need less? Do we need to consolidate? What do we need to do? Because as I stated, that was done back in 2009. ESAs. Now, ESAs, as I stated, they don't reach the level of being a PMEF or a MEF, but they are absolutely needed in order to perform and support the CMS MEFs. Now, some different examples of that would be managing timekeeping, payroll, travel, managing the necessary facilities, security, badging, and building access, communicating with stakeholders and others, supporting IT infrastructure for the agency's MEFs and ESAs. Now, if you just take a look at just those 4 examples, you could see that during an emergency, all of those will be very valid and very important to us as an agency. We would definitely still need to have IT. In order for the agency to continue to run, we would definitely have to have a secure, up and running IT infrastructure. We still have to have security. We have to have building security. You know, we'd have to have badging. We couldn't just have anyone just walking in and out of our facilities. And as always, everyone would still want to get paid. So those are all very important things. Those are just some of the examples of what ESAs are. But as you can see, all of those are extremely important to us as an agency in order for us to continue to function. Next slide. Now, during any period when the HHS secretary has died, resigned, or otherwise become unable to perform the functions and duties of the office of the secretary, we have the following people will be able to take over those duties, and they are listed here. Now, the reason why I put this on the slide is because the CMS COOP plan takes its direction from HHS, and everything that we do originates from them. So if you take a look at this slide, you will see that the CMS administrator is fifth in line to succeed the HHS secretary. So as an agency, we need to be prepared to handle whatever threats or events come our way. So as an agency, we need to make sure that we have our own orders of succession in place so that in the event of an emergency, we will have a correct line of succession set up so that the agency as a whole will be able to continue to function and move forward. Now, connected to orders of succession and running the agency and being able to make sure that you can do everything that you need to do, that's when we go back to delegations of authority, because they are extremely important as they specify who is authorized to act on behalf of the CMS administrator or other CMS officials for specified purposes. And what do delegations of authority do? They legally convey authority to subordinate officials, and they generally include the authority to sign a legal document and approve the actions taken by others. Now, each ERG member should ensure that he or she has the appropriate delegations of authority available for a COOP event. They should be listed on the ERG position profile, which we'll talk about a little later. They should be saved as a CMS component essential record, which we'll talk about shortly. And also need to ensure that the ERG alternates and their DERG counterparts have appropriate delegations of authority in place. So delegations of authority are extremely important. As we stated, they should be listed on the position profile. They should be saved as an essential record. And as an essential record, all the ERG alternates as well as the DERGs will have access to your drive that has those delegations of authority listed. Now, I ask you to keep in mind that each CMS center, office, and consortia is responsible for identifying their internal delegations of authority. They are responsible for conducting training on those as well. They're responsible for maintaining delegations of authority for emergencies and including them in their essential records, as I stated, and updating them as needed on an annual basis. Now, if you want to find out more information about delegations of authority, you can go out and look at the CMS Internet page, and there is a page that is specifically assigned to delegations of authority, and you can see the ones that are currently out there and that are in place. Now, I know all of you are aware of the continuity facility. If you're not, I'll tell you all about it right now. CMS as an agency, we have a continuity facility which is located in Frederick, Maryland. And that's a place where the ERG members can go to perform their mission essential functions and ESAs when central office facilities are not available. So at that facility, CMS leases 15 seats from HHS. And we are co-located with the Office of the Secretary as well as other HHS OpDivs. Now, at the continuity facility, as I stated, we have 15 seats or 15 desk locations. At each of those locations, we have a docking station with a laptop, computer screen. We have color and black and white printers. We also have a VTC system, as well as a file cabinet that contains our essential records. So if you haven't had the chance to go out there, I would definitely say please set up some time to go out there and take a look at it. It's a wonderful facility. Basically, everything that you need is right there. And when you go upstairs, you'll see we're co-located. It's like a wall in the middle, but there's these two huge rooms with a lot of tables, and all of the different tables, there are signs up that tell you which agency, and every agency has their own equipment and everything is set up and in place. Now, another continuity element that is very important is dealing with alternate work locations, telework, and work management. Now, COOP facilities and alternate work locations are options that are available to us in order to support the continuation of MEFs during a COOP event. CMS could use established office locations that are in Washington, D.C., Baltimore, Maryland, Bethesda, Maryland, areas, as well as alternate duty / workstations during an emergency. Now, with all of the different changes we have now, we also have the ability to use telework as an option. All staff have laptops, so they still have the ability that they can function and work from home. CMS also has another ability, and that's the ability to distribute workloads across unaffected offices, centers, consortia during an emergency. And also, by having senior leaders in the regional offices, CMS has an additional layer of resiliency during an emergency. So one of the things we want to keep in mind is there are a lot of options available to us as an agency in order for us to continue to function. Because if one area goes down, we can easily move that support function to someone else, as long as that person has been trained and they have the knowledge on how to do so. So it's very important that we continue to have the capability to do that. Now, this is the big one that I've talked about a lot, and that's communication. Without communication, everything fails. So there are two different types of communication. There's internal communication and there's external communication. Now, with the internal communication, CMS Central Office is responsible for administering agency-wide emergency communications. Now, in the regions, the consortia or the regional administrator is responsible for emergency communications. And they would work directly with the HHS director, the OHC director, and also the CMS Chief Operating Officer. Now, for external communications, that's where I said earlier, it goes back to having one voice. All external communications is coordinated through the Office of Communications, OC. The OC director or designee is the single voice for external communications during a continuity event. What items do we use for communication? We have CMS issued smartphones. We also use GETS, which is known as the Government Emergency Telecommunications Services, and WPS, Wireless Priority Services. We have the CMS Continuity mailbox, which I talked about earlier, which is EPRO at cms.hhs.gov. For communications, we use the assurance system. And I'm sure if everyone thinks back, in the past few months, the agency has started to use this a bit more. You started to see more, getting more communications via assurance. You start to get emails that say, please log into the system to make sure that we have, your correct information. Because in the event of an emergency, that's how that communication would go out. Not just to senior leaders, but also to staff. Because we all know, like I said earlier, when there's an emergency, staff are definitely calling, looking around what's going on. But by having this communication system, everyone is on the same level. Everyone is getting the same information at the same time. And what I really like about the system is that it scales back, it scales down. So if it tries to reach you at one number, if you have an alternate number, it'll send information there. If you have an email, it'll send the information there. So there's more than one way to get the information. And last but not least is send word now. Now that's an HHS system. Now only a select number of CMS senior officials have access to that. And once they receive information, if required to do so, they're then able to share that information with staff. So those are the different items that we use in order to communicate during a continuity event. Now here's a good topic, essential records. Oh, I'm sorry, I skipped one. Let's go back. The GETS card. Oh, that's a great topic too. That's something that I'll just, before I even go into talking about GETS cards, I'll just say this. We as an agency need to do a better job testing our GETS cards. And I'll hit on that a little bit more in a minute. Now, GETS, as I said, stands for the Government Emergency Telecommunication Services, and it is a White House-directed emergency telephone service. Now, during emergencies, the phone system can become extremely congested, which makes it extremely difficult to make phone calls. But the GETS gives us priority access to make local and long-distance calls. Now, CMS issues GETS cards to senior leadership, primary and alternate ERG members, DERG members, COOP support staff, and regional COOP personnel. And as I just said, as an agency, we need to improve our testing rates overall. Now, I went back and took a look at the last couple years. In 2017, the highest rate of people scoring was 65%, and that was in the second quarter. This year so far, the highest rate that we had was in quarter two, which is 66%. And our goal is 100%. So what I would suggest to everyone to do, and this is what I do, because when I first joined EPRO, I thought I had tested my GETS card and I didn't. So what I do is on a quarterly basis, I go in and I set it up, well now it's probably set up for infinity, but I have a reminder that reminds me to test my GETS card once a quarter. And me, I kind of go a little bit above. I have a reminder, I do it on a monthly basis. When that appointment pops up, it says test GETS card. I immediately go in, I test my GETS card, I go back in that same appointment and I change it from test to tested so that I know that I did it. Because sometimes, you know, you get busy and you move away from it and you go back and you look at it, did I do it or I didn't? So that's the best thing to do. It takes less than a minute, less than 1 minute. And all you have to do is dial that phone number, put in your PIN code, put in the designation number, which is a pre-recorded message. Listen to that pre-recorded message in its entirety. At the end, your feelings might be hurt because it will hang up on you. That's all you have to do, 1 minute or less. I would love if we could get to 100%. I would love to get to a number that had an 8 or a 9 in the front. So let's shoot for improving our GETS testing scores. Okay, now we can move on to the other thing that I was getting so excited about, and that's essential records. And before I start talking about essential records, I want everyone to keep in mind that everyone doing their job is an expert in one way or another. But that doesn't mean that someone can walk in right behind you and do the exact same things that you do. And I think as people, we take it for granted because we're doing our jobs every day. So it's like second nature, so we don't think anything about it. But can someone else come in behind you and perform the mission essential functions for the function that is assigned to you? Would they really be able to do it? Would they have the necessary information? So let's talk about essential records. That refers to information systems technology, applications, infrastructure, electronic and hard copy documents, references, and records that are needed to support the continued performance of MEFs and ESAs. They are vital to what we do as an agency and how we do them. Now, primary ERG members must identify the documents, records, files, databases, and systems that they would need in the event of an emergency or natural disaster in order to conduct business in other than normal conditions. In the absence of the primary ERG member, the alternates would use these documents as well as the DERG members if essential functions were devolved during a COOP event. Under the CMS COOP plan, the essential records for the ERG are to be stored and accessible at the CMS Continuity Facility in Frederick, Maryland, as well as the devolution leadership sites, which are Atlanta and Kansas City. Also, essential records are to be deposited in an electronic essential record folders that are maintained by OSARA. ERG members and alternates and DERG members have access to these folders. So another thing came to my mind. Each day we're all doing our jobs. We have standard operating procedures, business continuity plans. We have all of these different procedures on what we need to do. Well, of course, things change. Like I talked about earlier, you have a process you figured out that really doesn't work, or this system changed or that changed, which means that you need to change your procedures. But when you're doing that, if those are something that are related to how you perform your mission essential functions, those documents would need to be updated on the OSARA drive. So keep that in mind, because a lot of times we just go about our day, we're doing things are changing, we're doing it every day on our jobs and we're not thinking anything of it. But what about others? What about the alternate ERG members? What about the DERG members that are out in the region? Are they aware of the change? Did you notify them of the change? So we need to make sure that we have an open line of communication with them as well, so that they know about all of the different changes and they have the most relevant information. And you'll hear me talk about it again later. We always need to think about not how things are now. Today is a nice, beautiful, sunny day, but things could change. So when we're doing planning for emergencies, we need to think worst case scenario, because it could happen. Because I always tell people, when things happen, no one in this room, if there were an earthquake in this area, like we just had the exercise for the Great Shakeout, no one would be sitting here thinking, let me hurry up and get back to my desk. I need to work on that paper. First thing, you're going to be concerned about yourself. You're going to be concerned about your family. You're concerned about all other things besides this agency. So if others are to go and pick up that work, which would be the case if not just for a day or two, maybe a week, depending on the situation, would they have the necessary essential records in place in order to perform the function? Because I've had people say, well, I could just reach out. I'll call Jim Weber. Well, he might not be available. Then what would you do? I don't know. So we have to think about that. Think worst case scenario. Not that they would do the job better than you. We just need them to do a good job at doing what needs to be done. And do they have the necessary guidance and policies and procedures in place of what to do? The other thing we have to think about, systems access. Do they have access to the systems that they would need? If not, what would they do? So all of these things are very important. So don't think about it on this great day. Think about it when it's at the absolute worst. And think about if what you do was passed all the way down, and we had to do a full devolution, which we'll talk about in a moment, was passed all the way down to a DERG member in the region. Do they have everything that they need? Do they have access to all of the systems? Do they have all of the records? Do they have everything that they need in order to perform the function? Because the agency still has to continue to move forward with you or without you. The function still must be carried out. So I want everyone to take that very seriously and really think about that. During an emergency, another thing that's extremely important is human resources. In response to a disruption of normal operations, CMS continuity personnel and other employees are responsible for performing key business functions. And those are needed in order to continue performing the MEFs and the ESAs. Now, who are some of these people? You have the ERG, you have the DIRG, you have the devolution director, which is located in the region. You have the agency continuity point of contact, which is my boss, Gene Shield. You also have component COOP support personnel. You have EPRO COOP support personnel. You also have the CMS regional COOP POCs, which are the deputy regional administrators in all of the regions, as well as reconstitution personnel. All of these individuals are extremely important to the agency to continue performing its mission essential functions and ESAs. Now let's go more into detail about the ERG. ERG members are senior leaders and key staff who are responsible for continuing MEFs and ESAs after a catastrophic event. Now, they are designated each year by the CMS administrator. And the CMS administrator designates the primary as well as the alternate ERG members to include their critical business tasks that support MEFs and ESAs. Now, what are ERG members responsible for doing? They should prepare business continuity plans that detail how to carry out critical business tasks that are needed in order to support MEFs and ESAs. We just talked about that. And like I said, always think worst case scenario. Because we want to make sure that someone knows exactly what to do and how to do it in case of an emergency if you were not available. Now, if there's a COOP event, ERG members will be responsible for leading and making key agency operational decisions and recommendations. They will perform and or assign work as needed in order to continue the CMS MEFs. A very important thing also would be to account for CMS personnel. They would deploy to the continuity facility, report to an alternate location, or perform telework, depending on the type of event. They would develop, disseminate information to the CMS workforce, external stakeholders, as well as beneficiaries, and then reconstitute normal operations, facilities, and personnel once the event has concluded. Now, in order for us to be successful at what we do, I stated earlier that we would talk about the ERG position profile. And it all goes back to me saying, making sure that everyone has exactly what they need. So the position profile, it documents the key elements of each ERG position, and it serves as a resource to prepare and train continuity personnel who will carry out the critical business task of that position. Now, the position profile must specify the business task that the ERG member must carry out to support MEFs and ESAs. It also identifies the ERG alternates, subject matter experts, as well as the DIRG member. It will describe the resources that are needed, what record systems, what essential records, and what training and skill sets are needed to carry out these critical business tasks. Now, currently, EPRO has developed a new position profile template. And so far, we have had a number of ERG members to fill out that new form. If you have not seen or filled out the new position profile form, or if you have any questions related to this form, please send an email to EPRO at epro@cms.hhs.gov. Now, as I stated, this is a new form. And at the end of the form, there's a place that you can electronically sign the document. And as I stated, it'll have a listing of everything that would be needed in order for a person to perform that function that has been assigned to the ERG member. So, with that information, it would be shared with the alternates as well as the DIRG member so that they will know exactly what they need in order to perform that function. It'll list all of the essential records. It'll tell you where they're located. It'll tell you what systems they would need so that if they don't have system access, they can request it. So what we need to make sure that we're doing is that the ERG member, primary as well as alternates, and the DIRG member are communicating to make sure that everyone is up to speed and they have what they need. Always think worst case scenario. Worst case scenario. If you forget everything else I said today, think worst case scenario and say, okay, I need to do a lot of stuff. Just think of it that way. So the key for our agency is to always be prepared so that we can put our best foot forward. Because in the event of an emergency, that's the time that the agency needs to shine. We don't need to falter because we have too many people depending on us and what we do as an agency. So we need to make sure that we have everything in place. Now let's talk about the Devolution Emergency Response Group. Now the DIRG members are senior leaders and key staff that are located in the regions, and they are responsible for continuing to devolve CMS MEFs and ESAs after a catastrophic event that disrupts normal operations. The CMS administrator also designates the DIRG positions and their critical business tasks that support MEFs and ESAs. DIRG members must work closely with their ERG counterparts in order to learn how to carry out critical business tasks needed to support devolved MEFs and ESAs. Now, if there's a COOP event, what are DIRG members responsible for doing? They must be prepared to accept the functions of their ERG counterparts during the devolution of the CMS headquarter functions. They must perform and or assign work needed to continue these devolved MEFs. They need to be able to account for CMS employees. Deploy, if necessary, to an alternate location or perform telework, depending on the event. Develop, disseminate information to the CMS workforce, external stakeholders, and beneficiaries as needed as a part of devolution of the MEFs, and must be able to reconstitute normal operations, facilities, and personnel if devolution should occur. Now, the last continuity element that I wanted to discuss as related to the COOP plan is dealing with test training and exercises. They help to prepare CMS personnel to become more proficient with their roles and responsibilities of essential functions. And it also helps us to measure our state of readiness. Where are we? How are we doing? What do we need to improve? How can we get better? Now, each of you know that each year CMS participates in an event called Eagle Horizon. Now, Eagle Horizon, that's an annual event and is used across all U.S. governmental departments and agencies to validate continuity planning and implementation. In even number years, agencies are scored on how well they react and respond during an event. So as an agency, we always want to be ready because one day it might not be a test. It might be an actual event. And if you look around now, things are happening that have never happened before as it relates to weather. So anything is possible. Things are happening in areas that have never happened in areas before. So in an area that's not used to having tornadoes, there could be a tornado. You know, there could be an earthquake. So anything is possible these days. So now that we've covered all of the continuity elements of the COOP plan, now let's talk about the concept of operations. Now, the concept is intended to support the continuation of MEFs and ESAs during a continuity event, and they are broken down into 4 phases. You have the readiness and preparedness stage. Then you move into the decision, activation, and notification phase, the continuity of operations phase, and then you move into reconstitution. Now let's talk about the activation. When CMS becomes aware of an impending COOP event, or as soon as possible after an event occurs, the CMS Chief Operating Officer will notify and convene the ERG as well as the consortia administrators on a conference call. Now, during that meeting, the participants will discuss the agency's ability to carry out MEFs and ESAs. EPRO will also be involved and will share any information gained from the HHS Secretary Operations Center. The group will make an assessment based on the information at hand, and the COO will make a recommendation to the administrator on whether to activate some or all of the available continuity strategies, if any at all. Now, the CMS administrator makes the COOP activation decision. I repeat, the CMS administrator is responsible for doing that. If the decision is made not to activate the COOP plan, the administrator may still decide to implement some of the provisions of the CMS COOP plan to sustain the agency carrying out MEFs and ESAs during an emergency situation. Now, what options are available to the CMS administrator? There are a number of options. The administrator could choose to do relocation and telework, could choose to do devolution, could have a combination of those, which would be relocation, telework, and devolution, as well as let's just sit back and continue to monitor and reassess the situation as needed. Now, when specific disruptive events occur in the region, the consortium and the regional administrator that is affected will confer with other consortia and regional administrators, and they will make a recommendation to the CMS administrator to relocate their regional office if necessary. Devolution. That's basically transferring the management responsibilities for essential functions from the primary operating staff, which would be the ERG, down to the Devolution Emergency Response Group. And as I stated earlier, the two CMS devolution leadership sites are located in Atlanta and Kansas City. So think of it this way. Continuity of operations involves the same people at different locations. So for example, that would be the ERG members relocating to the continuity facility. Whereas devolution involves different people at different locations. So for example, the ERG member responsible for the Medicare Part C function will be transferred from that ERG member down to the DERG member in the region. So I repeat, continuity of operations is the same people in a different location, and devolution is different people at a different location. And as I said with devolution, the agency, the CMS administrator can decide to devolve all mission essential functions to the DERG, or he can only devolve a select number of those functions. It's completely left up to the administrator on what they decide to do. Now, this slide is just a picture that talks about reconstitution, and it's just telling you of what's important and involved in reconstitution, which would involve the personnel, operations, facilities, and information technology, as well as dealing with our mission and our programs. So what I like for the ERG members to remember are these items listed on this slide. And these are the ERG preparedness checklists. These are the things that are extremely important of what you need to be able to do. And that is to be prepared to carry out the MEFs and ESAs. Make sure that you complete and maintain an updated ERG position profile. And as I stated before, if you haven't updated the new template, please do so. Make sure that as an ERG member that you sign your designation letter. You want to be able to establish a process to account for personnel. You want to make sure that you have all of your needed essential records. You want to be prepared to deploy to the continuity facility, an alternate location, or be able to telework. You want to test your GETS card and your communications equipment. And as I stated, you want to make sure you test your GETS card at least once quarterly. Our goal is 100%. We want to maintain up-to-date internal and external contact lists, our SME list. We want to inform EPRO of any changes in component COOP personnel. We want to keep an open line of communication with your alternate and DIRG counterparts. My suggestion, a best practice, would be to talk at least once a quarter to make sure that they have the most recent and updated information. Even if nothing has changed, it doesn't take but a minute or two to just call, do a quick touch base, say, hey, nothing has changed. Do you have any questions? And just go from there. We want to make sure that you participate in COOP tests, training, and exercises, and make sure that you're familiar with the CMS COOP plan. And as I stated earlier, if you want to know where the information in the COOP plan stems from, where we get our direction from, you can go on the FEMA website and check out Federal Continuity Directive 1, FCD 1. Now, for the DIRG members, these items on this slide are extremely important for you. You need to be prepared to carry out devolved MEFs and ESAs. Make sure that you review the ERG position profile so that you know all information that is needed by you in order to perform that function. Make sure that you have signed a designation letter. Make sure that you have established a process to account for personnel and that you have all needed essential records. And as I stated, you want to test your GETS card and communication equipment, and make sure you test your GETS card at least once quarterly. Maintain up-to-date internal and external contact lists. Inform EPRO of any changes in personnel, and make sure that you keep an open line of communication with ERG counterpart as well. Make sure that you're talking, as I stated, at least once a quarter. Set up whatever time frame works for the two of you to make sure that you have the most recent and up-to-date information. Make sure you participate in COOP test training and exercises, and make sure that you're familiar with the CMS COOP plan. So with that being said, that concludes the presentation. Are there any questions that I have here today? Okay, for those of you who are viewing on YouTube, if you have any questions related to this presentation, please send your questions to the EPRO mailbox, which is epro@cms.hhs.gov. So I'd like to thank each of you for attending our annual mandatory training today. I also ask that you please be mindful that all CMS staff, including senior leaders, are required to take the HHS COOP 101 awareness training by December the 31st. That's a 3-part training. So I'm asking that you all complete this training in addition to this training, and also make sure that your staff complete this training as well. Now, I know that some staff have encountered some issues with getting into this training, and HHS is aware of it. I believe a CMS broadcast was sent out on yesterday talking about how they're going to phase it in so that everyone will have access to it. But please make sure that all staff complete those 3 parts for that training. That's an HHS requirement. Again, I thank everyone here for attending. For those of you that are here in the auditorium, please make sure that if you didn't sign in at the welcome desk when you came in, please do so. And please fill out the evaluation form, and you can hand it to either Dan Converse here or Pat Willis on your way out. For those of you on YouTube, you can send an email. Once again, you can send an email to the EPRO mailbox to let me know that you attended today. And you can also send in your evaluation form to that address as well, which is EPRO@cms.hhs.gov. Again, thanks to everyone for attending. Thank you all, and enjoy the rest of your day.